Patient-centered outcomes represent a fundamental shift in the landscape of modern healthcare. This paradigm moves beyond traditional metrics, focusing instead on the individual's lived experience. It signifies a crucial evolution in how we evaluate the success of medical interventions. The core of this shift involves moving the focus from solely measuring clinical markers. While vital, these markers often do not fully capture the patient's perspective. We are now looking deeper into the holistic impact of treatments and interventions. Understanding the true impact of treatments and interventions is paramount. This approach considers how medical care genuinely affects a person's daily life. It moves beyond disease statistics to personal well-being. The emphasis is firmly placed on a patient's overall well-being. This encompasses more than just the absence of disease. It includes their ability to function, their comfort, and their sense of self. Furthermore, a significant focus is directed towards a patient's quality of life. This subjective measure reflects how satisfied individuals are with their physical, mental, and social circumstances. It acknowledges that health is multidimensional. This approach sharply contrasts with traditional outcome measures. Historically, healthcare has often prioritized objective, quantifiable data. The new perspective integrates subjective patient experiences. Traditional measures typically prioritize physiological changes within the body. These might include blood pressure readings, tumor size reduction, or laboratory test results. While important, they offer an incomplete picture. Similarly, traditional measures often prioritize disease progression or remission rates. These clinical endpoints are crucial for medical research and practice. However, they may not always align with what patients value most. Patient-centered outcomes, or PCOs, prioritize what matters most to the individual patient. This means understanding their personal goals and values. It ensures that care aligns with their unique needs and aspirations. PCOs encompass a patient's physical health, recognizing its foundational role. This includes symptoms, pain levels, and functional capabilities. It acknowledges the body's direct experience of illness and recovery. They also critically encompass mental health, acknowledging its profound influence on well-being. This includes emotional stability, cognitive function, and psychological resilience. Mental health is integral to overall health. Finally, PCOs encompass social health, recognizing the importance of human connection and participation. This includes relationships, community engagement, and the ability to fulfill social roles. Health is deeply intertwined with social context. The core principle of patient-centered outcomes lies in eliciting the patient's perspective. This means actively seeking out and valuing their unique insights. Their voice becomes central to defining successful outcomes. It involves actively engaging patients in decision-making processes regarding their care. This partnership approach empowers individuals to take ownership of their health journey. Shared decision-making is a cornerstone of PCOs. A critical component is understanding patient values. These deeply held beliefs guide their choices and priorities. Recognizing these values helps tailor care to what truly matters to them. Equally important is understanding patient preferences. This includes their preferred treatment options, communication styles, and care settings. Respecting preferences enhances satisfaction and adherence. Furthermore, understanding patient goals is essential for effective care planning. These goals might range from returning to a specific activity to managing chronic pain effectively. Aligning care with these goals is key. Ultimately, PCOs focus on measuring outcomes that reflect these individual priorities. This ensures that the metrics used are relevant and meaningful to the patient. It moves beyond generic indicators to personalized success. Examples of PCO factors are diverse and directly reflect patient experiences. These are not just clinical markers but aspects of daily life. They provide a comprehensive view of health impact. One significant factor is pain levels, as pain profoundly affects quality of life. Measuring pain from the patient's perspective offers crucial insights. It guides interventions aimed at improving comfort. Functional abilities are another key PCO factor. This includes the capacity to perform daily activities, work, or engage in hobbies. Restoring or maintaining function is often a primary patient goal. Emotional well-being is also a vital component of PCOS. This encompasses feelings of anxiety, depression, hope, and overall psychological state. Mental health is inseparable from physical health. Social participation represents how well individuals can engage with their communities and relationships. This includes social roles, leisure activities, and support networks. Isolation can severely impact health. Finally, satisfaction with care is a direct measure of the patient's experience. This includes their perception of communication, respect, and the overall quality of services received. High satisfaction often correlates with better outcomes. Incorporating patient-centered outcomes leads directly to more personalized treatment plans. By understanding individual needs, care can be precisely tailored. This ensures relevance and effectiveness for each patient. This approach also results in more effective treatment plans overall. When care aligns with patient values and goals, adherence and engagement improve. This directly contributes to better health outcomes. The process involves tailoring interventions based on individual needs and preferences. This moves away from a one-size-fits-all approach to highly customized care. It respects the unique circumstances of every patient. Ultimately, this strategy aims at optimizing outcomes that are truly meaningful to the patient. Success is defined by what improves their life, not just by clinical benchmarks. This redefines the very concept of successful treatment. PCOS significantly improve patient-provider communication. The focus on patient perspective encourages open dialogue and active listening. This fosters a deeper understanding between all parties. This enhanced communication also builds stronger patient-provider relationships. Trust and respect grow when patients feel heard and valued. A strong relationship is foundational to effective care. Patients feel heard and understood when their experiences are central to care planning. This validation is crucial for their emotional well-being and engagement. It empowers them as active participants. This increased sense of being heard often leads to increased adherence to treatment plans. When patients understand the rationale and feel invested, they are more likely to follow recommendations. This improves treatment efficacy. It also fosters active participation in their own care journey. Patients become partners in managing their health, rather than passive recipients. This empowerment is a key benefit of PCOS. Beyond individual benefits, PCOS contribute to improved healthcare quality across the system. By focusing on what truly matters, care becomes more relevant and impactful. This elevates the standard of medical practice. They also contribute to improved healthcare efficiency by reducing unnecessary interventions. When care is aligned with patient goals, resources are used more judiciously. This optimizes the delivery of services. PCOs help identify areas for improvement by tracking patient-important outcomes. This data provides valuable feedback on what is working and what needs adjustment. It drives continuous quality enhancement. This approach optimizes resource allocation within healthcare systems. By understanding which interventions yield the most patient-valued results, funding can be directed effectively. It ensures investments deliver maximum impact. Ultimately, PCOs deliver better value in healthcare. Value is defined not just by cost, but by the outcomes that matter most to patients. This creates a more sustainable and patient-centric system. The data generated from PCOs informs the comparison of treatment effectiveness. It allows for a nuanced understanding of which therapies truly improve patient lives. This moves beyond purely clinical comparisons. This data also helps identify best practices in patient care. By observing what leads to superior patient-reported outcomes, successful strategies can be replicated. It fosters a culture of continuous learning and improvement. Finally, PCO data informs policy decisions at a broader level. Policymakers can use this evidence to shape healthcare regulations and funding priorities. This ensures that policies are truly patient-centered. Implementing patient-centered outcomes requires a multi-pronged approach across the healthcare ecosystem. It is not a single intervention but a systemic transformation. This demands commitment from all stakeholders. A crucial step involves developing validated patient-reported outcome measures, known as PROMs. These tools are specifically designed to capture the patient's perspective. They provide standardized and reliable data. Furthermore, the effective utilization of validated PROMs is essential. These measures must be integrated into routine clinical practice. They serve as a direct channel for patient feedback. PROMs are standardized questionnaires that patients complete themselves. They assess various aspects of their health and well-being. This direct input bypasses potential biases from healthcare providers. These questionnaires are designed to assess patient health status from their unique viewpoint. They cover symptoms, functional limitations, emotional states, and overall quality of life. PROMs provide invaluable subjective data. Training healthcare providers is fundamental for effective communication regarding PCOS. Providers need skills to explain the purpose of PROMs and interpret the results. This ensures meaningful patient engagement. Providers also require training to effectively elicit patient preferences and values. This involves active listening, empathetic questioning, and shared decision-making techniques. It fosters a truly collaborative environment. Interpreting PROM data is another critical skill for healthcare professionals. Understanding the nuances of patient-reported information allows for personalized care adjustments. It translates data into actionable insights. A strong commitment from healthcare organizations is indispensable for successful PCO implementation. This includes allocating resources, establishing clear policies, and fostering a patient-centered culture. Leadership buy-in is paramount. Integrating PCOs into clinical workflows is vital for their sustained use. This means incorporating PROM administration and data review into routine appointments and electronic health records. It makes PCOs a standard practice. Finally, using PCO data to drive continuous improvement is the ultimate goal. This involves regularly analyzing trends, identifying gaps, and refining care processes. It ensures that the system constantly evolves to meet patient needs. Patient-centered outcomes are fundamentally transforming healthcare as we know it. This shift represents a profound reorientation of priorities. It places the individual at the heart of all medical endeavors. This transformation is achieved by placing the patient at the center of the care process. Their voice, values, and goals become the guiding principles for all decisions. This humanizes the healthcare experience. PCOs are paving the way for more personalized healthcare experiences. Care is no longer generic but tailored to the unique story of each individual. This leads to more relevant and impactful interventions. They are also paving the way for more effective healthcare experiences. When care aligns with what patients value, outcomes improve. This ensures that treatments truly make a difference in their lives. Furthermore, PCOs are paving the way for more patient-satisfying healthcare experiences. Feeling heard, respected, and involved significantly enhances satisfaction. This builds trust and improves overall engagement. Ultimately, this approach improves individual patient outcomes across the board. From physical recovery to emotional well-being, patients experience better results. Their quality of life becomes the true measure of success. Beyond the individual, PCOs contribute to a more efficient healthcare system. By focusing on meaningful outcomes, resources are optimized. This reduces waste and enhances the overall value of care delivered. Finally, PCOs contribute to a value-driven healthcare system that prioritizes what truly matters. This paradigm shift ensures that healthcare is not just about treating disease, but about enhancing life. It represents the future of compassionate and effective medical care.